Okay. I can remember that. I'll write in your ear.
Get you out your new building, don't.
Hey,
Morning, everybody.
good shipping containers.
Let's call the meeting to order. This is a Kane County Public Health meeting for Wednesday, February 21st. And the time being 9:01. Clerk, please call the roll.
Doobie. Here. Silva.
Here.
Tarver.
Carver's here.
Williams. Young.
Here.
Sanchez.
Sanchez present remotely.
Strathman.
Strathman here. And I have remote request attendance for Mr. Tarver and Mr. Sanchez and Mr. Williams when he gets here. And do we have any objections to having them remote? Okay, do we have any objections? Going once, going twice. Okay, no objections, thank you. Okay, and now I'd like to ask for approval of the minutes from January 17, 2024. And a second, please.
I'll make a motion.
Okay, and a sec. Okay. Please call the roll.
That's something crazy. I've seen 4 offenders.
Doobie. Aye. Silva. Tarver.
Tarver, yes.
Williams. He's here. Okay. Young.
Yes.
Sanchez.
Sanchez, yes.
Strathman.
Strathman, yes. Okay, and we have some public speaking this morning. Did you get the list? This is what it is. Public speaker signed up to talk on agenda this morning. While we're getting the list, I'd like you to know that today is National Sticky Bun Day.
Sticky bun day.
Very important news.
I don't see anything.
Oh,
I'm with food. Yeah, I'm with food.
they came to
Food
America via Pennsylvania Dutch. I'll thank those people for bringing that to us. Okay, I have the list in front of me now. Mr. Ed Marth. Are you here?
Good morning. I came here to speak to the question about the building of the health facility.
Okay, you have
And-
5 minutes.
And before I get that, I was just reading something about Pascal's wager. Some of you are familiar with that, where the famous mathematician wondered whether there was God or not. And the odds are, who knows? So the better thing is to bet that there is, just in case. The same reason people buy lottery tickets, you might win $1 billion. You get no chance if you don't buy a ticket. And the same thing I think is true when it comes to planning for health. We know that there will be health emergencies. We've had plenty over centuries. We've had them most recently, and people can be prepared for it or not. Some people are gifted and fortunate to have good health all of their lives. Other people do not have that good fortune, and some start out with good health and it ends up going bad. It does eventually for everybody, as undertakers will tell you. So anyhow, with that in mind and thinking earlier about the proposition about building a new facility for the county healthcare, I prepared a few remarks, which are not very long, but I'd like to offer endorsement for the idea of using available funds to construct a new and needed health department facility on county property. The present facility is old and more space is needed for needed programs. We are advised that funds are available from federal grant to pay for the project. Having money is not enough reason to build anything. But if something is needed and funds are available for the purpose of modernizing, it should be done. Today's modern is tomorrow's antique, but we do need to keep up with the needs of today and as projected for tomorrow. We would not want to be in a 1940s operating room with tools of that nostalgic date when modern medicine and techniques are available. A health department is needed. That is beyond dispute. How big and the specifics are what for are outlined after a pandemic. Do we need more than the importance of being prepared to protect life? There are those who seem opposed to anything. That call is worn and uninformed. I am for small government, but not so small that vital services are not available for the common good. We need schools, we need police, we need fire departments, we need to have roads repaired so as not to be wearing out our vehicles unduly early. Parks are essential for quality of life, as is a local library, and more. That is the cost of being civilized. Some may take issue with this, but most who locate in King County are beneficiaries of the quality of life and having sensible decisions made by elected officials who do not need to be heckled for doing the work of good citizens. Thank you for making good decisions. Remember the admonition of Mark Twain, who said, "To always do right. It will please some people and astonish the rest." Please proceed with the Health Department proposal. And I have copies I can leave for anybody.
Thank you. Lori Powell?
Good morning. I'm Lori Powell. I've been a resident of Kane County for 20 years. I'm here to talk about the resolution I see in today's agenda. It doesn't have a number, but on the website, it was Resolution 24-1991. So anyway, I'm here to ask you to vote no. It is an $80,000 grant from the National Association of County and City Health Officials, NACCHO. It appears that the purpose of this grant is to hire 2 disease surveillance practitioners. The bulk of this grant is $64,000 for the 2 salaries. Once again, our county wants to surveil the residents under the guise of safety and health. The COVID pandemic, and I said plandemic because it was planned, was always about power and control, which purposely removed our freedoms and our autonomy. The COVID plandemic was never about health and safety. On October 10th, 2023, Dr. Dennis Rancourt and Dr. Joseph Hinkie published an evaluation of whether the COVID jabs actually saved millions of lives. Their results, and I quote, "There is no evidence in actual all-cause mortality data that the COVID vaccine rollouts had any beneficial effect. In fact, the contrary is apparent." And I emailed everybody in this committee, so you have that report so you can read all the details if you so choose. So let's look at the organization NACCHO that wants to give us $80,000 to surveil us. NACCHO appears to be a nonprofit that works in lockstep with the Centers of Disease Control to make sure every city and county are doing as they are told. Of course, the lockdowns and mandates cause many people to become very angry with the overreaches of governors and public health officials in response to that COVID pandemic, which has led to legislative proposals to eliminate or limit the emergency powers and public health authority used by these officials. In response, NACCHO has a training class warning public health officials that it'll be dangerous to have their authority removed. And I have included that training if you want to look at that and purchase it. I cannot since I'm not a member. This belief is in complete opposition to our constitutional republic. In a Supreme Court decision in New York back in 1914, Justice Cardozo set one of the most important foundation stones for modern medical ethics, the principle of autonomy in healthcare decision-making. And I quote, "Every human being of adult years and sound mind has a right to determine what shall be done with his own body." Autonomy means that all persons have intrinsic and unconditional worth and therefore should have the power to make rational decisions and moral choices, and each would be allowed to exercise his or her capacity for self-determination. But autonomy as a medical ethics principle is now under unprecedented threat locally and globally. It is easy to dismiss this $80,000 grant and believe it is beneficial to the community. However, I challenge all of you here today to really look at the NACCHO website and decide, do you see any real benefit? We don't need the federal government meddling with our county's health initiatives. It's time for us to guide our own public health and not be controlled by outside agencies or the federal government. Thank you.
Thank you. Okay, and the monthly financial reports are on file. Does anybody have any questions? Okay, then we'll move on to animal control. Good morning.
Good morning, everyone. My reports are on file if anybody has any questions about that. I do have a couple items for discussion today. We started a big review of our fees with the state's attorney's office help, and we learned that our fees have not been really updated since May 1st, 2013 was the most recent update, with May 1st, 2006, when the building was actually built. Most of our fees were put into effect. So we discovered it's 18 years later, it's time to start looking at our fees. Thankfully, we have done a lot of research compared to all of our municipalities surrounding us and have learned we're not too far off. There's just a couple of things we'd like to remove and a couple or things we'd like to adjust and 3 things we'd like to add. Looking at the items, we're updating just the 4 updates. The rabies vaccine is before you today. The only reason this one was separated out is because our first vaccine clinic is coming up April 27th. So we need to get moving on that one to have everything prepared for our flyers and for the clinic and everything. So that one will be before you today, and that's a $5 change. That will continue to be the lowest in the surrounding area, which is what our ultimate goal is to keep that as low as possible. The second one before you today is 2 of our boarding fees. And this is just because employee payroll costs are up, food costs are up, medication costs are up, and that's what all this boarding includes, and there are vaccines, distemper vaccines and Bordetella to those animals that come into the facility. So we're looking to change the neutered boarding fee from $17.50 to $25 a day, and the non-neutered fee from $35 to $50. Have I run out of time? Oh, just checking. And then the last fee, we're looking to change our owner surrender cost from 20 to 50. And this is very consistent with what our surrounding communities are doing. And it's just putting us in line. We were the lowest in all these areas, and this is just putting us more competitive in line. The 3 new fees we're looking to add is an after-hours pickup fee. The reason for this is when our wardens are on call, we're paying time and a half for these employees to go out. So we're just looking to recoup some of the funds we're losing during this time. This fee would only be from 8 p.m. to 6:59 a.m. Monday through Thursday, Friday at 8 p.m. to 6:59 Monday morning, or all county holidays. Basically, when our facility isn't open and we're operating on our on-call service, that's when we're looking to charge that additional $50 just to pay for that on-call warden that makes time and a half every time they go out. The second one is the stray animal, third and subsequent offenses. We've been doing a lot of research into this and seeing what other communities have been doing. Some of it can be seen on the notes above. The form I handed out today didn't have my notes on it because sometimes my notes get confusing. Other counties are doing this, and what that's doing is our repeat offenders really start to strain the county. We understand there's accidents, animals get away. We get that. We want to be able to work with those people. A second time, it still happens. A third time is we want to make sure that these people understand this is becoming a public nuisance, not only to us, to the neighbors, to the community, to any damage this animal does. The possibility of getting hit by a car, it increases a lot of the stuff. So we want to accordingly charge and fine these people that are allowing these animals to continue to run. Our last one we're looking at is low-cost euthanasia service, and this is one I really wanted to bring before the board today. This is something I've had a lot of board members discuss with me in my 10 years here, and just has never had the timing to bring it forward. With our full change of our services, our tag structure through the county, we decided now was the time to bring this forward. This would be a service that is needed. Unfortunately, coming out of COVID, I'm sure you've read the news articles, you've seen the story. City of Chicago did 2 huge articles that their euthanasia alone is up 25%. Behavioral euthanasia is increasing across the nation post-COVID. This is part of we got an animal, we brought an animal into our home at the beginning of COVID. COVID's now over, we want to get rid of the animal. Part of that is this animal spent 2 to 3 years of its life in a home with no one coming and going because we didn't move. Well, now that animal doesn't understand socialization to people that are coming into the home, we have increased bites from it. These animals are now going out into the public. They're not used to seeing other dogs. They haven't been socialized with people, with animals. We're seeing a big issue with bites increasing. Other behaviors, because again, there was no training classes there for like 2 to 3 years. A lot of these behaviors are causing shelters across the nation to increase euthanasias. There's a lot of articles. basically telling shelters now that it's okay. We all understand that we're all in this position together. We're all trying to do what we can. And we're hoping that once we get past this hump, things will regulate once again. The cycle of animals is usually about 20 years for everybody to cycle through and the new section to come through. So we know that it's going to take some time for this to occur. This is a service we feel we can help the county with. We do have a lot of phone calls every single day for this exact thing. People can't afford it. Going to your vet nowadays is $300 to $400 to $500, depending on what you want to do. It's a cost people can't afford. This is personal to me because when I was in the city of Chicago, I had someone come to me that they spend $5,000 in cancer treatment in their animal. They couldn't afford an additional $500 to euthanize. City of Chicago had this service and we were able to help them. It's not something people want to do. It's something people have to do. And it's a hard enough decision to make to then have to then find out you don't have the funds. Makes it even more difficult for people. Sorry, it's a sensitive topic. I know that. I also feel that if you're going to do it, you do it right. My facility is capable of doing this. We won't offer ashes back. You won't be able to stay with your animal, but it is a way to ensure that that animal is properly and respectfully euthanized and passed on to the next life, whatever your belief may be. So I wanted to bring that before the board today and see how you felt and see if you thought that these fees were in accordance of what you were thinking and if these new fees were acceptable and the new service was something you wanted to bring to the citizens of Kane County.
Okay, I'd like a motion and a second on this and then discussion and we can ask questions.
I'll motion.
Okay.
Second.
By Young and Leslie. Okay. And any questions? Dr. Silva,
Good morning. I'm going to be right there with you because as you know,
get right up to the microphone so we can hear.
I'm
you.
going to be right there with you because as you know, I'm a huge animal lover, both as a foster, an adopter, and an owner. Not all the same animal. One of the things that I would have liked to see is maybe separate some of these fees because I'm okay with some of them, but I'm not okay with others. So I think I need a little bit more conversation regarding maybe what's the average for a rabies vaccine. I know we increased fees last year, but I'm not sure I remember what it was for.
That was for the tags.
Oh, for the
95% of our fees come through those rabies tags, which is why the tag fee price is so important to us. These are more secondary fees that we have at our facility. You know, the boarding is only for animals that got picked up strain. The rabies vaccine is for people that come to our vaccine clinic. Our problem with that has been the manufacturer raised their price, so therefore the price had to be passed forward, sort of thing.
So what's the average cost in the area for a rabies vaccine?
To purchase
Yes,
or to
to have it for
have a
the-
veterinarian do?
Pardon me?
To have and I apologize, I just want to make sure I understand your question.
For the pet owner to pay.
The average at an animal hospital is around $50. And that's not including the office fee you have to pay. So there's an office visit plus the vaccine. So your minimum $100 to walk in the door at an animal hospital.
So therefore, the rabies vaccine, I would be a little bit more in favor of raising. It seems like it's low and we want to keep it low. We don't want to be the highest and we certainly don't have to be average. We can still be lower. The after hours pickup fee, I would be a little bit more hesitant because I wonder if that would then discourage owners from picking up their dogs. So if somebody loses their dog, I'm wondering if they can look at these charges and say, well, I'll just wait until Monday morning to pick up my dog. Then you're getting into a boarding charge. So I'm just a little concerned that this will discourage the owners from picking up their dogs.
I would love to have a discussion with that
I'd love to. Yeah.
offline, because
Okay.
I think if I'm able to explain a little bit more into that, it will make complete sense. I just don't know that it's appropriate to have here, but I think offline I could better explain how the fee structure works when people pick up. It's just detailed. Like if your animal's picked up on the weekend, you don't get paid at boarding. If your animal's, we look at it this way. If your animal is picked up after noon, tomorrow's day one, not today. So that first night you won't pay for it. The reason being is the animal has not been at my facility long enough for you to really be alerted and have the opportunity to come get your animal, because I close at 4:30 on Monday, Wednesday, Friday, 6 o'clock on Tuesday, Thursday. So I won't consider that day one if they didn't come, if they came in after noon. We had to draw the line somewhere. If they come in before noon, that gives you a chance to at least be posted on our Facebook, online, and a chance for owners to come. Weekends, we don't charge boarding. Reason being is I'm not there. It's not fair to you that I'm closed. Same thing with holidays. I'm not going to charge you a day's boarding. So we don't charge for Saturdays, Sundays, or our holidays. Sorry, pending whatever day it is. The reason being is it's not fair. You can't come get your animal. Why is it fair that the government's then going to charge you for that? So we factor all that in. So really, it's a 5-day average, 5-day stray hold for an animal. Every animal spends a minimum of 7 days with us. So you get an additional 2 days on top of what the state says. Reason being is we don't find it's fair to charge you for those weekend days when I'm not really open. I try to be as fair as I can to people, and that's where the number was actually factored in based on housing, food costs, and employee costs to clean, and chemical costs, excuse me.
Does that answer your question?
It does. Yeah. And I must say, when I walked into your facility, it feels wonderful. And I don't know if I'm shooting myself in the foot by saying this, but as an animal lover, I really appreciate it because it really feels welcoming and comfortable. And it almost feels to me like a pet motel. And I know you do, I hope that I'm not misconstruing something. You do what you can on a very low budget, and whatever you do it well. So I do trust your judgment.
If you lost your animal, people get very nervous where that animal is. They get very scared. It's not in their home, and I understand that. I want people to come to our facility, one, be proud of what the county does, two, be happy that their animal was in such a facility that was taken care of and cared about, to know that their animal was cared for, because that's the truth. And it's important to me that those things are then reflected onto the community, because again, we do this for the community. This is a service the county provides to the community to ensure that animals aren't running strays, they're not hit by cars, they're not being injured, they're not being tortured. These are all things that we take a lot of pride in, and we want to make sure that that is reflected in what we do. And again, when you come into this facility, I've walked into animal controls in my life and said, I hope my animal never winds up here. The fact that people come in, it takes a lot of pressure off. Then it becomes, oh, can I get my dog's jail photo? It becomes jokey. They can relax a little and understand their animal was in comfort and actually have a little bit of fun with their animal being picked up. A lot of people love to have that photo of their animal in jail. They think it's the greatest thing ever. So we do factor that all in when we looked at these prices to make sure, because again, I'm not here to nickel and dime our community. I'm here just to get reimbursed for the services we're providing is what I'm trying to do. I hope that helps.
Thank you.
Madam Chair,
Yes.
may I
Madam
ask a
Chair.
question?
Yes, Ms. Juby is first, and then,
Okay, so I'm going to try to get through this without crying. I'm not going to be able to. You let him go first.
would you like me to come back to you? Okay. Mr. Williams, did you have a question?
I did. I guess a question I have for the director is, I heard that we're talking about increasing fees, and I understand the need for that. But I guess where I differ a bit is, an opinion at least, is on the boarding fees over the weekend. If my dog is loose and animal control picks the dog up and it spends Saturday and Sunday, I would be happy to pay the boarding fee. We have staff, we have food, we're caring for the animal. So I would just ask that maybe you look at that policy a little closer, but in my mind, I don't think it's objectionable to charge a boarding fee over a weekend.
No, I hear what you're saying, and I do appreciate that opinion. Thank you.
Yes, Mr. Young?
David Young, I think these are all good ideas, and the euthanasia, definitely, I think adding that is good. And I'll be having to do that here soon. So I appreciate this.
Thank you.
Ms. Juby?
I'm okay with your raising your charges. do you have parameters on your euthanasia? Like, can you prevent someone who's just tired of their dog from coming in and asking you to kill it?
Yes, we have the right to refuse anyone. We also have the right in the contract you signed to surrender your animal over to me. It says that animal control is allowed to do a behavioral and medical evaluation to determine the best outcome for your animal. Animals will not be euthanized because husband and wife are getting divorced and one's mad at the other. Believe it or not, we get this call at least weekly. It's really frustrating. Or my husband now has the dog, you need to go do a well-being check. We get that a lot. I don't want to get caught between those things. We do have the right to refusal. We've discussed with our state's attorney about that. Because it is not a mandated service, we do have the right to refuse. We also have the right to the contract they signed to make the outcome decision we feel is best for the animal. And it will be notated on my monthly report. It will be owner surrender euthanasia, those completed and those saved. You will have those numbers because again, that's not something I'm trying to hide from. It's something I want to make sure the board is well aware of, part of this service.
Okay, thank you. Also, when you pick up the dogs, you said that you gave them shots. You give them distemper. What else do you give them?
Bordetella,
Have
kennel
we-
cough.
Have we ever had a problem with giving a distemper on a dog that maybe had already just recently gotten a distemper?
You never know, and that's the hardest thing. So your little animals, you don't double vaccinate, you single vaccinate, come back to them and give the second vaccine. Similar to like what they refer in little kids. We don't want to overwhelm their immune system. Every animal is given a vaccine early in the morning so that we watch them is the other thing, because again, it would stink if we gave it on a Saturday and then all of a sudden Saturday afternoon they have a reaction and no one's there. So no, we're very careful on that because we understand vaccine reactions. We understand things happen. You know, every animal's different, but 99.9% of the cases, we have not had an issue to date.
Okay, I've always
Sorry.
split mine, so it concerns me that
Yes.
not only are you giving them, but they might have already had it in their.
And that's
they
what it's
became
for. It's to
free.
ramp up because you're bringing them into an environment where distemper, rabies, kennel cough is high. I mean, I don't choose the animals to come to our facility, just like ringworm was very high this summer. We even have 2 dogs right now that have ringworm. Unfortunately, our cold snap didn't kill it. It's still out there. So we don't get a choice. We just deal with what comes to us and kind of, go from there. But we modify our intake protocols to ensure that if those sorts of things happen, we're attentive and we're on it.
Thank you.
Excellent questions. I believe, Mr. Tarver, you have your hand up?
I do. Thank you, Madam Chair. I just wanted, for clarity purposes, are we looking for a approval of all of these charges, including the euthanasia, in this resolution? Or are these
This-
separate issues?
Apologize. That was closer than I thought. No, this is not the resolution. The only resolution before you today is for the single rabies vaccine. The other ones I wanted to bring for discussion and make sure that the board was okay, because the state's attorney brought this to my attention of redoing all this, that we figured, let's bring it all at once to the board. Let's see what the board feels about it before we move forward and actually create that resolution. So again, the only resolution before you today will be the rabies vaccine, just because that clinic is coming up so quick. But the other ones, we can continue discussion if the board feels that's what they would like.
Thank you. That's what I thought too. I just wanted to clarify because of that new information.
Thank you for that
Understand.
clarity. Dr. Silva,
Can I ask my follow-up question, please?
I'm sorry. Yes, go ahead.
All right, thank you. I would just like to understand, and obviously I know this is a very sensitive topic, with the euthanasia, how frequent are you seeing that being brought to the attention of the department? Yeah, I'd like to know that question.
I would say we get phone calls almost daily for low-cost services, and euthanasia is one of them. We do have a couple we refer to. This is a service that Aurora Animal Control offers right now. A couple other in our community offer it. We just want to do our part as well, because we know it is so high right now, to try to help the county any way we can to alleviate some of that pressure. What we would be looking for is, because again, we also have to look at the toll this is going to put on staff. So we're looking to do it Tuesday, Wednesdays, Thursdays only, by appointment. So this way things are scheduled, things are prepared, because what we also don't want is an animal come to our facility, everybody out on a call or in meetings or whatever, and this animal sit all day, because that's not fair to this animal. So we want to make sure that we coordinate our staff and our resources accordingly to make sure that this is done. Again, with respect to the animal is what it's about. So I want to make sure the animal's being respected and my staff is not being overburdened and burned out.
I appreciate that. What is the process now when somebody comes in or contacts the department and wishes to do that? Who are you referring to?
A big one is Aurora Animal Control. I'm trying to think who, I don't remember what Anderson's fee is off the top of my head. They do have a low-cost clinic. Fox Valley Animal Welfare, I'm not positive if that's on their list, but we do have a full list at the front desk, and I apologize for not having it in front of me. They have a full list. We've done the research, so they're able to go to what services you're looking for, if it's spay neuter, if it's vaccine, or if it's end of life. A big one also right now is, if you're willing to drive, is Anti-Cruelty Society in Chicago. You can stay present with the animal. They have a whole youth services department that they put together, which is absolutely phenomenal. And I would only dream that one day we could do such a thing, but unfortunately, due to resources, we're not able to do the service that they provide.
And then one final question, Madam Chair, I appreciate the time and the opportunity. And this is a follow-up to Ms. Juby's question too, is that there would be a process in place, I would assume, very similar to those other facilities on accepting an animal and the guidelines in which the department decided was necessary and acceptable, correct?
Correct. We have a full euthanasia protocol now, and additions will be made based on the addition of this service if the board sees it necessary.
Thank you.
I
I
mean,
really
finds the
appreciate.
service necessary, excuse me.
Thank you. I appreciate the answers.
Dr. Silva?
I have a question and a statement. How is a euthanasia performed?
The animal would be sedated. Once it's sedated, then the drug we use would then be injected. When the animal is fully passed, we then, it is bagged, is put in our freezer, and is picked up by a local crematory that does all of our cremations for us.
Okay. And my suggestion is that we look into the policy of allowing of allowing the pet owner to stay with the animal as it's being euthanized for the sake of the animal. I think that that would be much more comforting for the pet, and I think it would be just more humane for the pet that somebody that it trusts can come with them in these final stages of life. So I'd really like to encourage us to look at that policy and move forward on it. Thank you so much.
There's a lot that goes into having the owner present. And unfortunately, us not having a full certified medical team takes some of that out of the equation, because it is wonderful when you can place the catheter, do a full wrap, have the owner present, give the sedative, let them go to sleep. It's something I'm comfortable with. It's not something my staff is comfortable with, because I've done it. I've been in the animal hospital. I've been on both sides of the table. For someone like me to complete is very easy. To get my staff there will take time. So it's just not something we're equipped and prepared to do at this time. I'm not disagreeing with anything you're saying. I want to make this as stress-free as possible, and something we've discussed is maybe sedating with the owner present once the animal goes to sleep. So we've had a lot of these discussions. It's a comfort level amongst my staff now, because you're asking other people that have never been put in these situations to handle it. And even sometimes dealing with the clients is very stressful. And again, something I'm trained to do, not my staff. And I can't guarantee I'm always going to be the one that's there is the problem. Like today I'm out. If one was scheduled for this morning, the staff would be handling it. So there's a lot to also factor into that decision. I'm not disagreeing. I ultimately hope that it's one day we can go there. And that's what I said about the Anti-Cruelty Society. We can hope to one day get there. I think it would be an amazing idea. I just don't think we're there yet.
And I have a question for you then. You do make that known, or since we're not doing this yet, you would make that known to the pet owner
Correct.
that would not be an option.
Oh, yeah,
for them.
everything would be
Right.
upfront. That's part of, we would write a protocol on what needs to be said over the phone, how it needs to be scheduled. We would need to create the scheduling, create the report. Like, there's a lot that would go into this decision if this is something we wanted
So
to do.
If they were a pet owner that wanted to be with them, then you would refer.
I'd refer, yes,
Okay.
at this time.
Uh,
Just like if you
Also,
want,
pet owner who has always been with any pets I've had to put down. So I understand your sentiment. And I just read a thing that a lot of vets say the one piece of advice they would give to pet owners is to stay with their animal to the end. But this is an option that I think is a valid option. And if
there are a
people do
lot of,
wanna- if we're all big babies when it comes to putting our fur babies down, then it's another option, I think.
There are a lot of people though that just want to drop off and leave.
I've heard
That's-
that
And
too.
that's the side we're really looking to is to start. Because there's a lot of people that don't want to be present. They don't want to see it done. They can't handle it. And respect 100%. I just want to make sure that again, we're not perfect, but we're at least perfect in the sense of the perfect system yet. But I want to start somewhere to ensure we're doing what's right by these animals.
Thank you. Any other discussion? Okay, then I think we can take the roll on the resolution for updating the vaccine fee. Do we have any other questions about that before we take the vote? Please call the roll.
Doobie?
Aye.
Silva?
Yes.
Tarver?
Tarver, yes.
Williams?
Williams, yes.
Young?
Yes.
Sanchez?
Sanchez, yes.
Strathman?
Yes. Passes? Okay, it passes. Okay, thank you for your time this morning. And now we'll move on to the Health Department and Mr. Isaacson.
Great, thank you. Good morning, everyone. Just going to share a couple of updates, and then we have some guests who will be presenting today. So we're excited to get to them. So I'll be quick, but I don't want to be too quick because I want to highlight some of the fantastic work that our staff is doing around the community. So here's just a few highlights of some upcoming events that we have going on. So first with the Kane County System of Care, which again is our Children's Mental Health Initiative, and All Our Kids, our AOK network, which is our early childhood network. Self-Love Isn't Selfish is coming up tomorrow evening. So that's a great event. And I don't know, Director Peterson, do you want to say anything about that, or does it speak for itself? So it's for parents and caregivers. Again, as we look at services that are available in the community, this goes for all of our behavioral health efforts. In some cases, being able to provide that support and an ability for people to be able to link with other people is hugely valuable. So we're proud to be able to partner with other organizations in the community to offer this. This coming Saturday, I'll be participating in a panel discussion with Congressman Foster and Jim Scarpace from the Gateway Foundation, talking about opioids and other substance use in the community. Our team will also be on hand at this event. This will be at the Aurora Public Library, distributing naloxone. So we'll just be talking about what we're seeing around substance use. So we've shared quite a bit of that information here with the board. And then I'll just point out Representative Foster has always been very supportive of these efforts, and especially as we're looking at effective medications and how we can use science to really be on the cutting edge of how we treat people who may be suffering with a substance use disorder. And then Mr. Scarpace at Gateway Foundation is a critical partner of ours in the community. He formerly worked at the Ascension Health System. Previously was a Gateway, now is back at Gateway, but has been a critical partner in our putting peers in the emergency department project. So I've talked about that over time. So we'll share more about that at future meetings, but excited that we're going to have peers in all 5 of our hospitals. So I'm sure Mr. Scarpace will be able to speak to some of that as well. Coming up on the 28th, we have Empowering Tomorrow, Cultivating Family Resilience. So this will be a session that is for our Spanish-speaking families. So again, working with the parents, and you had the opportunity to meet some of the fantastic parents that we have working with us here in Kane County last month. Was that just last month?
Yes.
Last month, wow. And so this is an opportunity again where we can really dig into those adverse childhood experiences, how we can support each other to build resilience. So this will also be in Aurora. And Director Peterson, anything you want to add for that, or?
No, just the parents that spoke.
Microphone, please.
Microphone, sorry.
Sorry. I'm loud. Just that the parents that spoke last month are open their own parent power center in Aurora, that what we heard about. So they're starting programming and that drop-in support. So not only does it create opportunities for those parents that are working in the community, but also to bring in new parents and to establish empowerment within them to take care of their families and develop resilience and continue to have peers to lean on and to support each other throughout, raising children, which we all know can be a difficult space. So I highly encourage anyone who would like to participate in any of these activities to drop in or schedule a separate tour with them. They have a lot to say and they're great leaders in our community.
And I'll just add one comment as we talk about where the health department facility is, work like this is going to continue. So we directly support these parents, work closely with them, not only in training, but also in providing resources to them. So services like this, as Director Peterson mentioned, they have their own space now where they're able to offer that. So this is really an investment in the community that we make an investment and it just grows from there. So this is really exciting to see.
Madam Chair,
Yes.
Roth here. I would just like to request, could you email out those flyers to all the board members? And I can't promise I can make them, but just so we have the information if we're able to.
And this is an excellent plug for our Facebook page. If you're not following us,
Okay.
that's a great place to go. And I want to specifically call out Tina Corral from our team, who's our health promotion manager, who does an excellent job keeping all this information up to date. But certainly we'll pass all these along.
Thank you.
We're excited to be starting a new series on the 28th in partnership with Mutual Ground, really looking at substance use and trauma. So this is exciting. You can see it's parent discussions around substance use prevention to start with. And I don't know if Director Peterson or Assistant Director Meyer want to say anything, but you can see so far we have these 3 sessions scheduled out. And again, how we can partner with community organizations such as Mutual Ground, who are providing direct services to in this case, many women who are experiencing violence in the community or maybe struggling with substance use disorders, men and women. This is just a really great opportunity for us to get out there and really touch the public who's in need. Anything you want to say about that one?
I just want to say, in addition to Facebook, LinkedIn is where we put a lot of our information and also our job openings. So just a little plug here to look at those open positions and share them with anyone you think would be qualified. But we're always keeping that up to date and making sure we're sharing things with the community. And then you can see, other partners will comment. And then we have a lot of exciting things coming up too.
Excellent. Thank you. Save the date coming up in March. So February is African American History Month. And then every spring, we are an active partner with the Aurora African American Health Coalition to present their health fair. So you can see this is the 17th annual health fair. And I don't know, Director Onwuda, anything you want to share about this event? We usually get a fantastic turnout at this. This again is another event that regardless of where the health department facility is, we will continue to support this event in the community.
Yeah, thank you, Director Isaacson. We've worked with the Aurora African American Health Coalition to host this health fair every year except during the pandemic. One of the opportunities for us to offer health screening to the public, so many testimonies coming from this health fair where people didn't even know that they had some chronic conditions, and these health screenings have allowed them to have a conversation with their physician. We usually have a physician that's present, just to give general information, and then when their results come out, they can follow up with their physician. And many of them have come to testify that without the health fair, they wouldn't have known. So it's open to everyone, regardless of where you live
And that's typically something that the health department provides is support for those screenings at the event. So it's really exciting. And then we have also in March an upcoming one of many opportunities where we'll be distributing naloxone, offering training to the public This is in partnership with many of the organizations up in the Elgin community, as you can see on the bottom of the slide there. So working with the township to be able to do that. This is ongoing outreach that's occurring as part of this program. So always exciting to see this. And if there's not questions, I'd love to.
Well, I just have a comment to
Yeah.
make, and that is that yesterday I was at the Veterans Administration Health Department with my husband. He had foot surgery. And when they gave him his pain meds, they also gave him Exelon to take home,
Excellent.
which is the first time. He's been getting his healthcare for a while, but this is the first time they had information and gave him a sample of it to take with him.
Very good.
Yeah, I was
Very
very
good.
happy to see that.
Great.
So,
And that is something I think there's a lot of really appropriate medical uses for opioids. So, you know, as we've looked at how to manage prescribing in the medical community, that is important that there's not overprescribing going on. But it's also a very important part of treatment for pain management. So having education and access to naloxone is critical.
Yeah.
So I'd like to transition and the opioid update, that's actually a duplicate that goes with the opioid resolution. So if I can go straight to well, actually, I'm skipping ahead of myself here, the gun violence discussion.
okay.
We are in order, but preview, we'll skip the opioid update when we get to
Okay.
it. So we have two guests with us today. One who is going to talk a little broader about some information that's been put together in the state of Illinois around securing guns. And then also we have one of our fantastic young employees who's leading our gun violence prevention efforts in Aurora. So I'd like to start and I'll ask my colleague Steve McHugh to come to the podium. He is the co-lead for Be Smart Illinois, and they have done some survey information or done some surveying, and I think it's really valuable, this information that they've pulled together. So I've had the opportunity to know Steve for quite a while, so very excited to share his information with the board today.
Welcome.
Thank you, Director Isaacson. And thank you all for having me here today. So I'm going to give a little bit of background and share the results from this survey that was conducted in October. Get it to move forward. There we go. Okay, so why is this important in the first place? So we know in households that lock up all of their firearms, there is a significantly lower risk of suicide and accidents among children and teens. We also know that 80% of firearms used in school shootings by teens came from their parents' homes or homes of friends and relatives. And also, 500,000 firearms are stolen each year, mostly from vehicles. So when we talk about secure storage, we're typically talking about safety. But there's another message that can be sent as well. In fact, within our research, we found that 26% of all gun owners do not have children or teens in their home. So safety might not be, safety of securing your gun might not be, you know, the first most persuasive message to them. The other message that could be sent and should be sent is the cost and the hassle of having your gun stolen. The average cost of a pistol is $650, so it's no small amount to be lost. You know, that's aside from the danger of having an illegal gun, a stolen gun in the community. So a little bit of background on the survey. This is a self-funded and self-sponsored survey, so no organizations have funded or sponsored this. I worked in the area of market research for 42 years. So obviously I started my career when I was about 3 years old. But so I was able to do most of the survey work myself with the exception of the out-of-pocket data collection. So the goal for Be Smart on secure storage is to increase awareness and actual practice of secure storage of firearms year over year. So how are we supposed to measure progress if we're not doing some type of survey on this? This data that you're going to see doesn't exist anywhere. So this is the first time that it's been collected. So it's we're going to be collecting it biannually because this data probably doesn't move all that quickly. So 2023 October represents the benchmark wave. This was a representative sample of the state of Illinois, English speaking age 21 plus, because that's the legal age of owning a gun. So when I say representative, it means if the majority of households are from Chicago, then the majority of interviews of completed responses are going to be from Chicago as well. Total sample size is 300. Sorry. Okay. No problem. Thank you. So these people, this is an online survey. So they take it on smartphone, tablet, or laptop. And these people are from a panel. So some of you might have been on an online panel at some point. They're recruited and they agree to take surveys. They're compensated by points. So taking a survey might be worth a couple of dollars or so that they save up and can cash in for an Amazon card or something along the way. So average interview length was very short, just over a minute. You want to keep these surveys short because the longer they are, the more people are rushing through and the survey data becomes a bit wonky. Data was collected in mid-October via SurveyMonkey platform. So some of the audience we have had thus far, this is the last background chart before we get into the data. This is just a partial list of audiences starting in October. Kane County community leaders, Mayor Burns, State's Attorney Mosser. Sheriff Hain was unable to make it, but Under Sheriff Johnson was able to be there and others. From that meeting, it led to a bunch of other meetings and audiences that we have had, including State Representative Maura Hirschauer. We've met with the Illinois Alliance to Prevent Gun Violence. That's actually, we're presenting to them tonight. The National Gun Safety Consortium, met with them on Monday. They were very interested in this data because they don't have access to this type of data. So getting into the data now, we're starting with just firearm ownership. So we don't come right out and ask, do you own a gun? The question is, if there are any firearms in your household or in any of your household's vehicles, how are they stored? And they have the option of saying, there is no gun in my household or any of our vehicles. So 42% of all Illinois households own at least one firearm. That is highest in the central and southern parts of Illinois. Again, the majority of our interviews come from the Northeast, which is Chicago and the suburbs. More than half of our interviews come from that area because it's a higher populated area. So rural areas at 57% have the highest prevalence of gun ownership. We also looked within the Northeast because there's such a large sample there, just breaking that down by urban, suburban, and rural. And you see that suburban households at 36% are just as likely to have firearms as urban area at 35%. So how are they stored? 60% lock all of their guns, 18% lock some, and 22% lock none of their guns. Least likely to lock all of their guns in those areas, such as rural areas that we just said, it's where most of the guns are at. So it's less of an awareness issue as it is a persuasive issue. Again, maybe, the cost of having a gun stolen and safety messages. So you would think that securing your guns would be highest among those households that have children or teens. That is not necessarily the case. It's 63% of those households versus 58% where there's no children or teens present. What is higher, significantly higher, is locking up some of their guns at 24%. And we hear that at different events or tabling events that we go to. We hear, hey, I have grandchildren visit my house, so I lock up, all of my guns except for the one I need to get to quickly. It only takes one to have a tragedy. But that's what we hear a lot. Also, the reason that people don't lock up their guns, the main reason is that they have to get to it quickly. That is the main reason that we hear. Okay. The same thing is going on among the group that are aware of the secure storage message at 20% versus those who have not heard it at 5%. So again, they're locking up some of their guns, but we really want to move the needle on locking up all of their guns. Specifically within homes, so we're going to look at homes versus vehicles. 42% have a firearm in their house. How are they locked up? Most likely they are using a locked safe or case. That's not biometric, 39%. Unlocked in a drawer or a nightstand, a little over a quarter, 26%. Biometric lock at 22%, and the least likely way of locking up their gun, the least desired, the least used, is this type of lock that I'm holding here, which is a cable lock, okay, which we give out for free. I know the health department gives them out for free. Police department does as well. They are the least desired and least used. So why are biometric locks not used as much? They're my personal favorite. You can open them within a second. So it's the solution to getting to your gun quickly. With a fingerprint, you open it very quickly. There's a perception that they're more expensive than they really are. So when we show it to people, a lot of people are guessing that it's $200 to $700. The one that I have holds 2 pistols and it costs $55 on Amazon. So it's a big misperception of how much those cost. We also looked at some of this data by income levels. So those households that have $50,000 or less, 50 to 100,000 or 100,000 or over. And there's no difference in firearm ownership across those 3 income groups, 43%, 41%, 46%. We also looked at those using cable locks, thinking that those with lower income, because cable locks are basically free or very inexpensive. So it was not the case. They're used equally. Biometric safes, we would think, are used by more upper income. That is not the case either. Where the difference exists is upper income are the least likely to lock up their guns. The theory there is probably they are more likely to own more guns. So, one of their guns or more are not locked up. Within vehicles now, 22% of all Illinois households have a gun in their vehicle. And whereas when we just talked about the home, you are much more likely in rural areas to have a gun in the home. That's not the case within the vehicle. You're just as likely to have a gun in the vehicle in urban and suburban areas as you are in rural. And the most common way of storing a gun in a car is unsecured, in a trunk or in a glove box or under the seat. And that's why there's so many thefts of guns from vehicles. And to me, this is some low-hanging fruit to communicate. Okay. Also looked at this by income level, and again, $100,000, the upper income are least likely to lock up their firearms in vehicles. Okay, so just concluding here, some specific actions that we feel that can be taken, and this is, through discussion of all the different audiences that we have spoken with. Post information and videos on your websites and other communications, encouraging secure storage of all firearms, not just some, all firearms in homes and especially vehicles. In addition to safety benefits, communicate the theft, the cost and hassle of having your gun stolen. Biometric and other safe or case raffles, giveaways, rebates, and tax breaks. So, for example, the state of Virginia offers a $300 tax break if you show, I purchased this, a receipt from having purchased a safe or whatever. Raffles, you see, very often raffle for a free gun or whatever at $650 just for a pistol, more for a rifle. You can be doing raffles for 10 biometric safes, have 10 winners instead of one. We learned that the village of Glen Ellen offers a rebate. It's built into their annual budget every year, that they have a $100 rebate. Again, if you show a receipt that you purchased a lock or something like that. So most of the audiences that we've talked to are really interested in that type of approach. Clarify the prices of safes. They're a fraction of the firearm cost, and spread the word. There's contact information if you know other audiences who would like to hear this. Just some longer term solutions too. The auto industry could offer optional secured gun safes in vehicles or on rifle racks, locks on rifle racks within automobiles and pickup trucks. The insurance industry, this was actually an idea from State's Attorney Mosser, offer discounts for secure firearms storage. So we all pay less for auto insurance if we're a safe driver. We pay less for life and health insurance if we're a non-smoker. So why not have something similar for secure firearm storage? Okay. Questions or other ideas?
Are there any questions? I have a question. Can you go back a couple of slides? Yeah, yes, one forward from that.
Sorry. This one here?
Yes. Would you repeat what you said about that slide?
Okay, we get into some small base sizes here because these are gun owners who then have firearms within their cars. So this is showing that upper income are the least likely to secure their firearm within their vehicle.
Thank you. Yes, Dr. Silva?
Thank you. Regarding suicide prevention, could you please reiterate the statistics you used with youth who use their parents' gun? You mentioned that. Could you go over that one more time?
Yeah. What we were speaking on that is school shootings. So 80% of firearms used in school shootings came from their parents' homes or homes of friends and relatives, specifically on self-inflicted firearm injuries, so suicides. You have a 78% lower risk of that in homes that secure all of their firearms.
Thank you.
Yes, Mr. Young?
David Young, I'm looking at this slide here. Is that 500,000 firearms stolen in Illinois each year?
That is in the US.
Oh,
I don't
How much
know
in
the
Illinois?
exact, I don't know the exact number within Illinois.
okay, because we were just talking about Illinois.
Yeah.
Okay.
Correct.
Any other questions or comments?
Madam Chair, I have a comment.
Oh, yes, Mr. Tarver.
Steve, I just want to say thank you for your time and presentation and all the work that you're devoting to this. It's a very important issue, and just being tenacious in your work and the people that are working alongside of you. I applaud all your efforts, and thank you again for coming and presenting this to us today.
Thank you, Mr. Tarver.
Thank you. Yes, Mr. Roth.
Hi, I'm Roth here. Have you worked with any of the veterans group? You know, this is a big concern. One of the groups I'm working with, Support Over Stigma, there were veterans suffering from PTSD. And the big concern when they get uncomfortable, an option to be able to store it without necessarily losing it. They're at a point in time that they're at a low.
Yes, thank you. We are working with them and other groups are working with them. The Brady group, Howard Miller, is a veteran himself and he is working with them. We are working with some Vietnam veterans on this area as well. It becomes a little bit more difficult. Most of what we're talking about here is asking the parent of the child or the teen to secure their guns to keep their children safe. When you are the owner yourself, that becomes more difficult. And then you're getting into different areas such as a firearm restraining order where, you know, to have the gun away from you.
Okay. I mean, if you haven't worked with that group, I can do an introduction for you. Because I think it would be important to.
Would love to have more contacts there, yes.
Okay.
Mhm.
Thank you.
Thank you.
Mr. Tepe, did you have a question?
No.
Okay. Any other questions? Thank you for an excellent.
Thank you. Thank you.
I really appreciate that.
Yes.
So I think this is really information that's very vital, and I just want to, you know, really highlight the kind of the sensible person's approach that Be Smart takes. There's certainly strong feelings around guns in the United States. And what we're looking at with this is what can we do to prevent shootings, right? So whether that's self-harm, whether that's somebody stealing a gun and utilizing it. So, you know, I know a lot of gun owners and none of them want their gun. Certainly they don't want their child to use their gun. They don't want accidents. They don't want their gun stolen. This isn't about gun control. This is really how can we take an approach where we reduce the amount of injuries, accidental or intentional, that are occurring in the community. So I really thank Mr. McHugh for his time with that. Now I'd like to introduce one of our young employees, a newer employee who's a new public health professional who just joined us within the last year and has been doing a fantastic job as Madam Chair Strathman, I think, has mentioned before. We like to start bringing people every month to highlight the great work that's going on. And I'd like to call to the podium Caitlin Soriano, who's our violence prevention coordinator, and she's going to share a little bit specifically about the work that's going on in Aurora with the project that she's working on. So, Caitlin.
Morning.
Good morning. Thank you. Is this good? Everybody can hear me? All right. Well, thank you for the introduction, Michael, and thank you everybody for welcoming me into your space today. Like Michael said, my name is Caitlin Soriano, and I'm the Violence Prevention Coordinator for the Kane County Health Department. And today I'm going to talk about our violence prevention program. So to understand the program, let's see. Oh, cool. To understand our program at the Kane County Health Department, we should understand how this program began and initiated. So it starts off with IDHS. So on the IDHS website, they stated that firearm violence is a multifaceted challenge that requires a public health approach to stop the cycles of violence in disproportionately impacted communities. Under IDHS, they created the Office of Firearm Violence Prevention under the Reimagine Public Safety Act in 2021. So the Reimagine Public Safety Act is a comprehensive approach to violence prevention in response to the state of Illinois' heightened experience of loss, harm, and trauma by the hands of firearm violence, especially during the COVID-19 lockdown. So underneath the IDHS, they have the Office of Firearm Violence Prevention that has the Firearm Violence Research Group. They have applied a process to determine the Chicago community areas and greater Illinois municipalities that rate highest in firearm victimization, excluding self-inflicted shots. So on the chart on the right, you see on the left side, they have municipalities in the greater Illinois that were granted the Reimagine Public Safety Act. So Aurora is one of them. And on the right side is the list of the communities and neighborhoods in Chicago that were also granted the act. So I do work for the Kane County Health Department, but specifically on a grant for Aurora. So to better understand how the Reimagined Public Safety Act was distributed in Aurora, I created this chart. So there are 3 different subcategories from the grant. So one of them is violence prevention. There's 3 organizations in Aurora that are granted to do specific violence prevention work, such as street outreach, case management, and victim services. That would be the African American Men of Unity, Challenge to Change, and the START program. All the way on the right side, there are organizations that were granted to focus on youth development. So that's programming such as career involvement, extracurricular activities, mentoring, and STEM learning, and much more. Those organizations are the African American Men of Unity, Leaders in Transformational Education, Boys and Girls Club of Elgin, and the National Youth Advocate Program. Notice how I mentioned Boys and Girls Club of Elgin, how it says Elgin, and it's a Aurora grant. So we do work a lot closely with Kane County organizations because they still overlap and serve members of Aurora. And in the middle, there is the Violence Prevention Coordinating Council, which is me. So it's the lead organization and agency to work across each community to coordinate violence prevention resources. I also continue the local advisory council model, which is the coalition, and provide consistent feedback to IDHS on Aurora's best practices, challenges, and barriers. So through this grant, we created the Project Safe Aurora, which is a violence prevention coalition. And this coalition consists of members from the grant, the RPSA grant, which is in the top right. And I'm also going to list off all the other organizations and members that are represented in this coalition. We have the Association for Individual Development, 360 Youth Services, Mutual Ground, West Aurora, East Aurora, Quad County Urban League, Fox Valley Christian Ministry Alliance, Carina Villa's Office, Community Advocacy Awareness Network, Family Counseling Services, Prairie State Legal Services, A-Town Boxing Club, Suicide Prevention Services of America, the City of Aurora, Aurora Township, the Aurora Police Department, Community Officer Police, and ICEJA, we have representative from the Family Violence Coordinating Council. So this group met together in the fall of 2023. So they did create their own name. So we are called the Project Safe Aurora, the Violence Prevention Coalition, with a vision statement that states, in accordance with the Reimagined Public Safety Act and in unity with our partners, we envision an Aurora where every individual is empowered, supported, and thrives in peace and safety. A community so resilient and unified that the thought of turning to gun violence fades away, making Aurora a beacon of a violence-free future. And our mission statement is to foster awareness of gun violence, build bridges within the community, and advocate for systemic changes that protect and uplift every resident of Aurora to reduce gun violence. Through research, community collaboration, and innovative approaches, we strive for an environment where safety and health are intertwined. This coalition and group meets on the second Thursday of every month at 1:30 p.m., and members of the coalition are able to join our emergency response meeting team. So in correspondence with IDHS grant, we convened to address a recent shooting incident, focusing on immediate crisis management, long-term support strategies, assess community needs, discuss prevention interventions, and foster collaboration for effective response and future mitigation efforts. Through this coalition, we also provide trainings to organizations and community members regarding violence prevention, racial equity, organizational capacity, restorative practices, and much more. And as we mentioned, that we did have a free gun lock initiative. So we really emphasize the need to secure guns against thefts and accidents, to protect loved ones and from accidents and misuse. And we want to prevent unwanted access, harm, and tragedies. Since the fall of 2023, we have been able to distribute over 2,200 gun locks to the whole entire Kane County. And we have collaborated with over 20 different distribution partners throughout Kane County, and that list is still growing. On our website, there are locations that are open for walk-in pickup during their hours. And we also have gun locks available at resource fairs, organization fairs, and also community events too. We were also able to, in November, have a social media campaign, which was #LockedAndUnloaded. And that was a whole week of social media posts for the National Injury Prevention Day. And our upcoming events, we have saved the date for a community violence panel and resource fair. So the purpose of this event, of this panel, is to amplify the voices of individuals who have personally experienced the profound impact of gun violence within our community. By providing a platform for those with lived experiences, we aim to foster a deeper understanding of this issue, the issue's complexities, and inspire collaboration efforts towards practical solutions. This community event seeks to create inclusive space where diverse perspectives come together, enabling a dialogue that extends beyond traditional boundaries. So this flyer right there is the one I released out to the Project Safe Aurora Coalition, inviting like organizations and nonprofits to set up informational booths and tables because we will have a resource fair as well. And the whole month of June is National Gun Violence Awareness Month. So we do hope to have a cultivating community event, which will be announced soon in support of the Wear Orange event. And this right here is pretty much just emphasizing that Project Safe Aurora did just begin this fall. So in August and September, we were really building up the coalition. We created the name and our vision, mission and vision statement in September. It leads up to all the great work we've been doing up until this month, which is February, which is continuing on discussions, talking about goals and priorities to accomplish over the next few months. And on top of this, we always have the free gun lock distribution. We're always building our coalition capacity, always onboarding members to IRIS, and continuous data collection plans such as surveys, interviews, focus groups for feedback, recommendations, and barriers to best practices to share with IDHS. So that's all I'll leave you with. On the top right, there's actually pictures from our coalition meeting last month. Mr. Dan Barrerio took those. And I'll leave you with a quote. It says, there comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in. From Nobel Peace Prize winner Desmond Tutu. And I was remembered of that quote the other month when I went to a restorative practice conference, and it kind of stuck with me to explain like what public health is and prevention work. So just want to leave you all with that. My information's up on the screen if you want to reach out to me. And thank you.
Thank you very much. Are there any questions? I think it's commendable that you've given out 2,200 locks since the fall. How is that usually done? Do people call, or do you have them at events, or both, or how is it done?
It started out with initial outreach. I kind of just cold emailed a bunch of organizations and libraries. And then from there, the word started getting around, and people have been emailing me to schedule pickups, and I've dropped them off all the way to East Dundee and Big Rock and all these locations. So yeah, if anyone wants to just reach out to me. And we are at a lot of community events as well.
Excellent. Excellent. Thank you for an excellent presentation.
Thank you.
Okay.
So yeah, I just want to underscore Caitlin's doing a fantastic job, and you know, in her spare time also is involved with boxing with youth in Aurora. So you know, when she came to us, we were really excited with her engagement, and tying back to some of the other things that we've been discussing at the broader meetings that we've been having about a new facility. This is exactly a model of what we do. We identify an issue in the community. We do outreach, do what one model is called asset mapping, to look and see who's out there addressing this already, what's going on, bring partners together, and collectively we come up with ways that we can intervene. So this isn't the health department doing something by itself. This is us working together with our community partners. And as Caitlin shared, we have a very strong coalition that's been put together, and it's still really in its infancy. But I think that the skill set and for the young professionals like Caitlin, I just can't underscore enough what a great job she's doing, and being able to bring all of these people together. That's not easy. And getting people to the table to not necessarily just focus on, oh, what's in this for me, but to say, yes, I'm willing to come into this space and give up a little of the what's in it for me so we can have what's in it for all of us. So really exciting.
Yes, Dr. Silva.
Madam Chair, thank you. I actually took a little bit of heat from some of my colleagues because as a public health expert, my opinion is always buildings don't save people. People and programs save people. And Caitlin, I am so encouraged. I missed part of your presentation, but I promise you I will go back and look at it because I am intrigued by everything that you're saying. And I think this is what saves people. So you really have a wonderful mission in life. Thank you for sharing it with us. And these are the types of programs that we need to talk about, that we need to see, so that we can build a building so that these programs go into, because the building itself isn't saving anyone. Thank you.
Any other questions or comments? Okay. You want to move on to the resolution?
Our first resolution is to accept a grant from the National Association of City and County Health Officials, NACHO as it's called. This is our national member organization that the Kane County Health Department is a part of. This funding, what we're requesting here is that we would create 2 seasonal positions that would be able to work on this grant. And Director Onwude, do you want to share a little bit about this work?
Yes, I think we mentioned this at the last meeting. This is a grant that we received that local health departments, it was a competitive grant that we won. And it's actually about training the health department to go out to long-term care facilities and train them on infection prevention, infection prevention and control. So imagine during COVID when we had, mom and dad in the nursing home, you want to make sure that the condition in these long-term care facilities are good. And one of the ways is to make sure that they understand what they need to do about infection prevention. This is one thing that we found out during COVID, that a lot of these long-term care facilities were found wanting, but it wasn't the time for us to start to educate them on the primary functions of infection prevention. So now that we're done with that, we're coming back and saying, these are the issues that we found. How do we go about it? So this funding is going to help us to train healthcare systems, healthcare organizations on infection prevention and control. Thank you.
Okay, I'd like a motion and a second and then discussion on this resolution.
Tarver moves.
Moves.
Juby second.
Juby seconds. Any discussion? Yes, Ms. Juby.
I just have a question. So on these, oh, sorry, can I just talk to him?
Yes.
Okay, so on these 2 people that we're hiring them to actually go out into the other healthcare agencies, right? And then how are they getting trained, or they're already trained because that's what you guys already do?
So this is the training process. So CDC and NACHO will be working with, this is a learning collaborative.
Okay.
To teach all of our communicable disease staff on these infection prevention practices that will then use to, it's kind of like a train the trainer, train to train.
Okay.
Healthcare.
So this is basically giving us the manpower to go out and hit all of the areas that would be needing this service. So when we hear surveillance, that's not really what they're doing.
No.
What they're doing, I mean, that's what this does, and that's what Google does, but it's not what this is. These guys are just going out, they're getting trained, they're teaching people how to recognize it, how to have best practices in hopes that they're preventing the spread of more diseases, whatever the diseases are. And are 2 people enough?
Yeah, I mean, this is a resource limited thing, so 2 people are enough. And as Director Onwude said, this will also include training for all of our communicable disease staff. But with this grant, it's a one-time grant, so that's why we're making it seasonal positions. So when the grant's done, these are short-term positions that we'll be filling. Okay, so is it enough? No, probably not, but we have a grant for this right now, so it's good for now.
Dr. Silva, you had a question?
Yes, thank you. I would like to have a broader conversation in public health, and I would love to see us move away from the term surveillance, because that makes me nervous, and I can understand how that term could make folks nervous. And, thank you to those who took the time to address us today. And I understand what you're saying, because I don't want anybody watching us. Commissioner Juby did touch on the fact that we're probably already being very watched, but I certainly don't want the government to watch me. I can tell you from personal experience, I was employed in many, many years ago in public health surveillance. And what that meant simply was people who had active tuberculosis disease, as a young lady, I would go to their home and I would watch them take the medicine, so that we could help to contain the tuberculum bacteria, the mycobacterium. So I understand the fear, I really do. And I would just like to really see us get away from that term of surveillance, because I understand where people are coming from. And it's not that's not really what we want to convey. We want to contain disease and we want to keep people safe. We don't want to watch their every step or even monitor to see if they've had COVID vaccines, many other vaccines. And I just think it's a touchy term. So in your conversations with public health officials, maybe we just need to move in a different direction. Thank you.
Yeah, and I think we can focus on education. It does get a bit tricky because surveillance is a core public health function. But as you pointed out, it's not the surveillance that people think of. But it is in all the higher education for public health professionals. Surveillance is the term that's used, but it's not spying on people, right? It's
not
like you
spying
said,
on
it's
people.
monitoring the level of disease in a community. So we can do more education about that at a future meeting.
Yeah, and a
definitely.
medical term that we use commonly is complains of. And it has a connotation when the physician takes his or her notes, complains of, and it has a negative connotation, but it's a medically accepted term. And so we have to move in the direction where we make it friendly for the folks that are getting this healthcare and are involved in our public health system so that they understand and we don't convey these negative thoughts to this ugly term. So just my opinion.
Oh, thank you.
And I can understand, I agree with the wording is uncomfortable for some people and not clear for a lot of us. Maybe we can just add something to that as we transition to finding a new way to say it all together. I think that'd be a good idea. Mr. Young, did you have something to say?
Yes, David Young, thank you. And that is my reason for not voting for this is because it says disease surveillance practitioner. That is the title of the individual. And then it says that they're going to be involved with infection prevention and control learning collaborative project activities. I'd like to understand what are the infection prevention and control learning collaborative project activities that they will be doing if this does go through starting from day one? And the other question is who are these people that you're hiring? I mean, it's a seasonal job, but do these people need to be, do they need to have some kind of an education in health or do they need to have an education in surveillance? I'm just, if you can answer that question for me, thank you.
Sure. Do you want to talk to the skills that we'd need for that?
Yes. So surveillance practitioner is one of the job titles that we already have at the health department. And, I appreciate Dr. Silva because when she said it, I was like, that must be where we're getting, surveillance is a public health term. It's not a public safety term. Well, maybe it is for them, but that's, when I sit down, I'm a trained epidemiologist. When I sit down and I'm looking at numbers and I see that the rate of a disease is going up, I go, oh, something is happening here. We need to find out more. So I dig more into the numbers. I'm not looking at anybody. I'm looking at numbers. I'm doing, tests, nothing to do with anybody. We're not monitoring anybody where they live or, unless, like, if it's a restaurant and people went to a restaurant to eat and got sick, and we need to know, did my colleague and I, after the public health committee, we went to lunch and we got sick. So is it the trip we took to that restaurant made us sick, or maybe something else that we ate somewhere else? So that is what we're talking about. It has nothing to do with trailing people parking in front of my house to see what I'm doing and when I'm eating or when I'm walking my dog. I don't ever use the word, but that's not what we do. A surveillance practitioner, is mostly about numbers and about diseases. Why are they sick? What do the people have in common that is exposing them to a particular illness. So I understand that some words that are supposed to be used for something that's really innocuous is being, aligned with something that has nothing to do with public health. So we will take it back and, have a conversation about it and see what we can do. But surveillance practitioner is a job title that we have at the health department that, you have a bachelor's degree. Many of them have masters prepared in public health. So it's not, I don't know what else people are doing that's surveillance, but that's not what we do.
Right. And I'll add too, with something like a learning collaborative like this, and we appreciate the NACCHO opportunities, we'll be working with other professionals around the country to see what are the newest things that have been proven to work to reduce infections in these long-term care facilities. So as Director Onwuda mentioned, we lost way too many people in our long-term care facilities during COVID. We know people were struggling with keeping up with their infection control measures. So this is an opportunity for us to work with people, experts around the country, and learn from each other so that we can assure that we're bringing the best information forward to help protect our residents who are in these facilities. So I think this is really vital work.
Yes, Mr. Young?
David Young again. Okay, so my question is, I guess specifically, starting day one that you hired Debbie Smith and she has a experience in the public health. What will Debbie Smith do on that first day? And then what will she continue to do in this position as her title of disease surveillance practitioner? And let's forget about that. That is her title.
Mm-hmm.
What does she do for your department?
Okay, so with this project, the two surveillance practitioners that we have for the project, this is a learning collaborative, as you rightly said. So we already had our first meeting yesterday, just to, to get more information about what the grant is about. So essentially, we need to put a plan in place, before we go out there to train the long-term care facilities. We need to learn, better hand washing, are people wearing their gloves the right way? You'd be surprised at how much infection results from people in the operating room not gloving properly. There are so many other ways, if you have anybody in the long-term care facility, you would know some of these diseases are because of practices that are not kosher in terms of infection prevention. So we're going to learn those infection prevention practices for healthcare facilities, and then we'll come back and have a plan in place. Before this grant is done, we must have a plan in place of how to train long-term care facilities. So the purpose of this is to have that plan in place to learn those infection prevention practices so that we can train those long-term care facilities, healthcare facilities, not just long-term care. So that's the purpose of this grant.
Does that satisfy your answer?
No, but let's move on.
Okay.
That did not.
I'll be happy to talk to you longer if you want to after.
And part of this is a resource issue that we don't have people who have the time to go out and do this training now. So that's why this grant is very helpful, because our current staff are busy in investigating diseases and trying to keep up with the caseload that we have. So having these additional resources that expands our ability to do that outreach and conduct that training is why a grant like this is so helpful.
Thank you. And to sort of circle back, I think, our English language is a living being sometimes, and it evolves and develops. And sometimes words that we used to think meant something, they take on a new meaning or a new application. And I think that's what's happening with this word surveillance in the public health. So I agree with Dr. Silva. We may need to figure out a better way so people do understand what it is we're trying to do. And I sort of think of this in my own head as sort of a calling tree. This person teaches somebody at a facility how to do it so they can teach other people at the facility so it can go and be practiced. And it's so important. And, you know, sometimes we just get a little complacent about our infectious disease control things that we can all do. So, okay. So are there any other questions or comments? Thank you for an excellent discussion. Thank you. Okay, then I think, are we ready to take a vote on this? Okay, so would you just read the title of the resolution again so we know?
So this is authorizing acceptance of the National Association of County and City Health Officials Infection Prevention and Control Learning Collaborative Project Grant. That's the resolution, and it's both to accept the grant and to allow the creation of these 2 seasonal positions.
Okay, thank you. Okay, take the call, call the vote.
Doobie,
Should I?
Silva,
Yes.
Tarver,
Tarver, yes.
Williams, Young,
No?
Sanchez, and Strathman.
Strathman, yes.
It passes.
Passes, okay. Okay, that would be interesting to hear a follow-up on that.
Yeah, these learning collaboratives are really exciting to
Yeah.
be a part of, to learn from other people.
Yeah.
The next resolution is authorizing us to engage community partners to do activities that will reduce overdoses in the community. So this, just a quick summary, this is grant funding we have. This is all completely budgeted. This is federal funding that comes down through the state of Illinois to the Kane County Health Department. We did do a competitive request for proposals for this, and the organizations you can see are listed at the bottom. Today, we're asking for permission to enter into agreements to purchase contractual services for the total of $222,159.31, broken down as follows: $25,000 for work that's going to be done with Advocate Sherman Hospital, $50,000 that's going to be done with the Association for Individual Development, $30,000 for a partnership with the Kane County Coroner's Office, $50,000 for the Ecker Center, $50,000 for Lighthouse Recovery, $12,300 for the Path to Recovery Foundation. It looks like there may be a duplicate there. The 50,000, I'm assuming that's a typo, that AID is on there twice. So that's a Scribner's error. We can erase one of those. And then the Elgin Area Chamber of Commerce, $4,859.31. That's where the 31 cents comes from. This is an opportunity to work with the Chamber of Commerce with an innovative outreach opportunity to get education and information out to people about overdose prevention.
Can I have a motion and a second?
So moved.
Tarver seconds.
And Tarver, thank you. Any discussion on this? Yes, Ms. Juby.
I just have a question. What is the coroner's office doing in this partnership?
So with the coroner's office, we are working on a overdose fatality review board. This is something that for a couple of years we've wanted to set up. So this is where we would really drill into fatal overdose cases and get into the details. So rather than it just being numbers, we have a better understanding of what's actually happening, and also working on data collection with them so that we can get more timely information about what's happening with our overdoses, and then other outreach and collaborations. But I defer if Director Peterson or Assistant Director Meyer has anything they want to add.
Nope, you explained it perfectly. Yes, Mr. Kenyon.
Mike Kenyon, can you give us some stats or figures on the history of overdoses and how many have been saved with Narcan? I mean, you may have 100 overdoses, but if you save 200, that's pretty good.
Right. So we have seen an increase in overdoses in Kane County, just like we have across the country. Our increase is actually lower percentage-wise than many places in the country. And I think how aggressive we've been, not only in Illinois, but specifically here in Kane County with getting information out to people and getting naloxone out has really helped. The presence of fentanyl, as we've discussed, has really been problematic because it is so highly fatal. So that's why we've seen that increase continue. Over the last 2 or 3 years, we've seen this interesting trend where Heroin deaths have actually declined pretty sharply. And now we're starting to see fentanyl showing up in other drugs that maybe people weren't expecting it to be in. And again, drugs are illegal. We encourage people not to do them, but we do know that people do use drugs for a variety of reasons. So people may be using cocaine or other substances, not expecting there to be fentanyl. And one time is all it takes so that people are dying. So we're trying to get this information out, trying to get people linked. And this is where other projects we do, like our peers in the emergency departments and also some of all the other grants on here, where we can increase access so there's not waiting lists so people can get in and get treatment more quickly. But we were approaching 100 fatal overdoses this past year.
And you statistically keep track of fatal overdoses and overdoses.
Yes,
Okay.
and we track, and this is one part since I've taken this position, we've created a new division and added an additional epidemiologist, and we're really drilling into this information so we can see not only who's dying, but also who's visiting our hospitals. And we can really get into the information. And that's why we're excited for this new fatal review board, because that's going to give us much more detail than we get just from the regular coroner reports. But we have a variety of different resources that we use. So we have real-time surveillance of our emergency departments. We have systems where we can see where Kane County residents may be going to hospitals in other areas or maybe dying in other areas. So we have that information. But then also, I think with the lab work, and certainly the county's investing in increasing lab capacity with the coroner's office and the sheriff's office, with the number of chemists out there in the community who are making drugs. Unfortunately, fentanyl is something that's a big issue, but we're seeing animal tranquilizers like xylazine or Tranq, as it's called on the street. We're seeing increases in that being included in fatal overdoses. And then there's some other new designer drugs that are showing up. And I think for us to be able to, for our Director Alleman and her team to be able to really dig into that data in a more real-time way is going to help us to get interventions out there in the community quicker.
Excellent. I have yes, Dr.
go ahead.
Silva? Oh, I'm sorry, Mr. Young.
You were saying something and I raised my hand. Go ahead first.
No, I was going to ask our parliamentarian a question here. If there's a Scrivener's error in the resolution, can we just, this is listed twice. Listed up here. AIU. Okay, I just wanted to make sure we handled it correctly, so.
Drugs and suicide.
Yep.
Move it and second could just add to their motion to Scrivener's error.
I will modify my motion to accept the removal of the Scrivener's error of the Association for Individual Development, $50,000.
And Mr. Tarver is a second.
There's a second on that amendment, yes.
Okay, thank you. Okay, now, Mr. Young, you had a question or a comment?
I did. David Young, you had mentioned receiving these grants and that you're going to be doing all of this data and a deep dive into the data. Tell me again, how is that going to, let's say, affect future youths, to call them youths, from taking and getting these drugs for the very first time and getting addicted to them? So I don't quite understand how this grant and this research will allow you to do that, but explain that to me again, please.
Yeah, absolutely. It's a very good question. And I think these things are all holistic. So when we look at even all of the events that are coming up that I shared in my PowerPoint slides, that's all substance use prevention. When we support families, when we give them what they need, when we talk about adverse childhood experiences, those are things that potentially lead people to self-medicate later in life. So some people just experiment. Drugs can be very addictive. So that does happen. Many people, most people are self-medicating when they're using drugs. And so that's something that if we can help people earlier, that's better. With the grants or with the services that we're talking about looking at here, it kind of runs the gamut of providing direct counseling and support. So if somebody does have a substance use issue, this funding is going to pay for them to get treatment. So that's something that's hopefully going to help people get out of it. But I think part of your question too about the lab information, if we don't know what's happening out in the community, and this is a form of surveillance, that's how we know where to put our resources. So if we know what's in somebody's system when they have a fatal overdose, we know then what intervention needs to be put in place. So we've seen with fentanyl, we're having discussions statewide, nationwide right now. Is the way we're providing naloxone the best way to do it? So we started with training police officers. Now we've expanded to friends, family, loved ones, anyone who may be around somebody who is using a substance. We were able to make that transition based on the information that we were getting, seeing where the overdoses are happening and seeing who's being impacted. So the more information we have about that, that really shapes where we need to go in the community and what we need to do. And this transition from heroin to other drugs, that's pretty significant. That may change how education happens. And again, yes, drugs are illegal, but we know large numbers of people do use drugs in our community in the United States. So how we talk to people and who we talk to about what they need to be aware of and where fentanyl may be changes as we look at the information that we get from things like this.
Excellent question. Any other questions or comments? Okay, please take the roll.
Doobie,
Should aye.
Silva. Silva, yes.
Tarver, yes.
Williams. And Young.
Yes.
And Sanchez left. Strathman.
Yes. Motion passes. Okay,
Quick comment.
yes.
Yep. Just Shupro, Special Assistant ASA. I just was looking into Mr. Young's point and some of the other points about definitions. When you look at the dictionary definition and the epidemiological definition, you understand why some people could get the wrong idea. You look up surveillance in the dictionary, it says close observation, especially of a suspected spy or criminal. And if you look up public health surveillance, it says the ongoing systematic collection, analysis, and interpretation of health-related data essential to planning implementation, which is a very different concept, but it, I think, illustrates how sometimes when people use words, they should think about not only the dictionary meaning or the scientific definition, but how that comes across to people who are not expert in that field. This
Thank you
was an interesting point.
Yeah, thank you. Okay, is there any old business before the committee? Okay, I'd like a motion to place the reports on file.
By unanimous consent.
Yes, okay. We can ask for unanimous consent to place the reports on file. Anybody?
Yes.
Mr. Young asked for unanimous consent, so thank you, Mr. Young. Okay, I don't believe an executive session is needed. Is there any new business for us today? Okay, and then I do have, Mr. Young, you wanted to speak off agenda this morning?
Yes.
Okay. You'll have 3 minutes.
Okay. I'm waiting for the timer. Okay. Okay, David Young, there was an article published last week. It was the largest ever global study on the effects of COVID-19 vaccines that has found links to increased blood, heart, and neurological related conditions. The study, which examined data from 99 million vaccinated individuals, 99 million vaccinated individuals, was performed by the Global Vaccine Data Network and published in the journal called Vaccine last week, February 12th, 2024. It found that mRNA vaccines, those made by BioNTech, Moderna, and Pfizer, were linked to an increased risk of myocarditis. Viral vector vaccines like AstraZeneca's were linked to an increased risk of cerebral venous sinus thrombosis, which is a type of blood clot in the brain, and an increased risk of the neurological disorder called Guillain-Barré syndrome. Hope I pronounced that right. Guillain-Barré syndrome. Now, researchers looked for 13 medical conditions considered adverse events of special interest among 99 million vaccinated individuals in 8 countries, seeking to identify higher than expected cases following a COVID-19 vaccine. The scientists also discovered a link between mRNA vaccines and an increased risk of pericarditis, and increased risks of the inflammation of the spinal cord and inflammation and swelling of the brain and spinal cord after taking viral vector vaccines. So this new study is actually the largest and most comprehensive, and it points to serious health risks associated with COVID-19 vaccines. And I bring this up to the health board here because we need to put this kind of information out on our website. I've asked this of the director several times that we actually provide this information so that you can understand that there are risks associated with these COVID-19 vaccines. And you could take it, it's a free country, you could take it if you want, but you need to have, you need to provide this information. Also, one other thing, and I have a couple of seconds. In January 31st, there was a report that was put out that said that reports of myocarditis following the shots were 233 times higher than the average of all vaccines combined for the past 30 years. Think about that. Thank you.
Thank you. Okay. Any comments before we end the meeting today?
I'll just make one comment. And I think one thing I'm glad that we live in a time when we can do the research as Mr. Young is alluding to, because it's critically important that we're studying all of these things. One thing I'll point out, though, is that the vaccines do also help prevent things like myocarditis that can happen from getting COVID. So I think it's, there's a change that the risk of getting myocarditis from having COVID is also elevated, but it's still critically important that we do this. And we do put our fact sheets for all the vaccines. I don't know how many pages the information sheets got up to at the end, but it does list what the risks are, just like any medication. So we do make that all available to people so that anytime they get it, they sign that they have seen and have all that information available to them. Because I agree, it's critically important that people have information so they can make an informed decision.
Okay, now I need a motion and a second to adjourn.
Second.
That can't help you.
And we can take a voice vote. All in favor?
Aye.
Aye. Okay, opposed? Okay, meeting's adjourned.